For those of you who've taken Module 1, this will constitute some review. We won't spend as much time on it here as we did in Module 1, but we did want to go through it again because it's relevant to this module and it's important. And we know that not everybody has started at Module 1. So there is no single or certain answer to what causes mental illness, and we need to keep in mind that, as we said way back in Module 1, mental illness is an extremely broad term. If we talk about physical illness, it would clearly not be the same to say that the cause of, for example, a common cold and of diabetes are the same. There is a very broad range of disorders we can talk about in this category. We do know that there is a genetic underlying cause for many mental illnesses. In some cases, the genetic cause means that the person has a predetermination that they are going to have that mental health symptom. But in more and more cases, we're starting to understand that the genetics of an individual may point to them having a predisposition. In other words, it's not a guarantee that they'll have that mental health disorder, but just that they're more likely to have a mental health disorder as a result of their genetic code. There are also prenatal and natal factors, such as, for example, when we talk about prenatal factors, we're talking about things that happen while the child is being developed in the gestational period, in the womb of the mother. And we can all be aware, of course, that alcohol and drug use by a mother may affect the individual in terms of their later life and in terms of their development. But we can also talk about things like the nutrition of the mother and the overall stress and fitness level of the mother as well. We know, for example, that things like smoking may have an effect on the developmental rate of a fetus, and whether or not a fetus is as fully developed or has achieved as much of a healthy state by the time it is born seems to be affected by things like smoking. But there are also natal factors. In other words, what happens during birthing itself. For example, oxygen deprivation or potential trauma seem to occur. And there are these other factors that happen early on in postnatal development, such as whether or not the mother herself is able to actually nurture the child. Now, we don't have particular precision in how much this matters, but there has been considerable psychological thought over the years about how important it is for a mother to begin nurturing or demonstrating warmth to her child, and for parents in general to be responsive to a child early on in their life. And so the next one, and one that probably most of us would consider to be some of the most important, are the socialization and family environment of an individual. And particularly we look at the responsiveness of parents and the warmth of a parent. We look at whether or not they show affection, whether or not they're quick to respond to their children. We also look at things like consistency and what we call authoritative parenting, which is parents who catch their kids doing things well and give them praise and guidance around that, and teach them coping mechanisms, help them to develop resiliency, versus parents that are more authoritarian, who are sort of strict and always telling their kids what they're doing wrong, or neglecting or indulgent parents who perhaps let their kids do more on their own than they probably should. But there is no particular right way to parent a child. We know that it needs to be adaptive. And as much as we've talked over the course of this module and other modules about assessing and addressing, we also know that's important for families to do with each other, to understand the individual needs of their kids and address them as necessary. So again, that goes back to that concept of really being responsive. And over the years, the science around this, or the social science around this, has been very interesting, because people have often argued, what's more important, for example, the school and neighborhood that a child lives in, or the immediate household that the child lives in? And what appears to be the case is that you could, for example, raise a child in a low-income, high-crime neighborhood with lots and lots of negative role models around. But if you're a really effective parent, they tend to grow up to be better mental health-wise, and in terms of their social capabilities. On the converse is also true. If you're not a very engaged and effective parent, but you raise a child where there are lots of social resources and very few examples or role models of anti-social behavior, they can still be lost to poor mental health and poor physical health. And so really one of the key ingredients we know is that family relationship. And it doesn't have to be the traditional nuclear family. It really is more important the quality of the parenting than whether or not it's coming from two parents of two genders. That part seems to not be terribly important. Stress and trauma can be very important, and we have to keep everything relative here because we have to remember that stress is not just defined by how bad the event was for the individual, but how equipped they were to deal with it. And of course, we look at the developmental level of a child, not just what they have in terms of other resources such as parents and counselors. So, for example, in strange ways, a child who's sexually abused, for example, at 5, 9, and 14, in some strange ways, the child who's younger in some ways may not actually be as affected adversely as the child who's older and has a stronger sense of what it is that they've gone through and may be more present in terms of memory as well. If you think back in your life, there's much that you don't remember from your childhood before the age of 5. So we have to keep in mind the developmental level of the child. We have to keep in mind the stress and management techniques that the child has developed, and the social resources around a child, including their family's response. And we have to remember that trauma and stress are different as well. So trauma is normally thought of as an acute and severe event that affects an individual, such as violence, rape, or war. But stress can occur in more subtle and insidious and chronic ways, where an individual, for example, lived in impoverished circumstances or where there was constant conflict in a family. And these things can play a role on their own or in combination with each other. Substance use can be a response, as we said in a few slides back. People can use substances to self-medicate, but substance use can also be the primary cause of a mental illness. In other words, an individual may use a substance, and they may use it once or they may use it chronically, and they may have downstream psychiatric effects as a result. And we talked in the first module about the effects of marijuana and the emerging research that is showing that there may be a connection between marijuana use in adolescence and psychosis. So in some cases, we would think of particular diagnoses being resultant from exposure, even in a short but acute way, severe way, to a substance, and others would be from the long-term use. And it should be mentioned that in some cases, the substances themselves are medications meant to address another thing. So for example, there's a condition that is caused by individuals using psychoactive medications for a long, long time, and it's called tardive akathisia. And there's another one that's called tardive dyskinesia. The person who has tardive akathisia has a strong compulsion to remain in motion, often a disembodied sense of anxiety. And that particular effect often comes after a person has used antipsychotic or other psychoactive medication for a long period of time. And these medications may have been prescribed by their physicians. And by the way, tardive dyskinesia refers to the individual having aberrations in their movements and motions and feel the need to, for example, engage in tic behavior or tremor behavior. They often look like, for example, people with Parkinson's disease because of it. And the biochemistry and neuropathology of a person, and this is probably connected to their very genetics, is also a part of what's going on. Although it could be, again, a factor of something, for example, prenatally, such as alcohol consumption. So we often hear people say, well, mental illness is caused by chemical imbalances in the brain or by organic differences in the brain. But that sort of begs the question, what caused the chemical imbalance or what caused the organic difference in the brain? And so really this is not so much an explanation of what causes mental illness as more of an explanation of what it looks like at a physiological level. And the illness can also be brought on by infection or by some other agent. So for example, a person could have cancer, and the cancer itself could then affect their brain. Or they could have a fever, or they could have something like, for example, meningitis, and that could actually cause them, for example, to be oxygen deprived or to have other downstream symptoms which later on affected them psychologically. The other one we want to think about, and there's much considerable discussion around this, is what role does society and the media play? And I don't have a definitive answer for you here, but we could certainly debate this. The question is often asked, does, for example, exposure to television and violence and so forth cause a higher incidence of psychological illness? And the answer to that question is still yet to be determined. And there is research out there suggesting that both views are valid, but it is so much, as is so often the case in social science research, there are so many variables and so many difficult things to be able to control that the results are not definitive. What are the implications of a mental health diagnosis? What happens to people who are diagnosed? Well, as we said way back in Module 1, most people will learn to adjust. Many of the people that have mental health diagnoses go to their general practitioner, get a prescription, get monitored, make adjustments in their life, and continue on. But even then, there's that adjustment period. What happens to people who have more serious mental health diagnosis or in that transition period of adjustment? Well, for some people, there can be social alienation, isolation from their loved ones, and feelings of loneliness. And these, in turn, can have downstream effects on the mental health condition. They can make it worse, or they can make the person do something, for example, that leads to a secondary disorder, particularly substance use. Many times people have issues around their ability to maintain a job, and as a result they may be impoverished, they may have inadequate housing, and not so much in Canada where we have free access to health care, but in countries where people have, for example, to get their insurance often through their employer, they may have a diminished ability to access physical health care. And even in Canada, for some people, because they may, for example, have housing in an inopportune neighborhood or not enough money to pay for transportation, people can sometimes have difficulty accessing the healthcare programs designed for them. There are often inadequate mental health services, and this is particularly true as we move away from the heartland regions, the dense urban cores and suburban areas, for example, here in British Columbia, and Canada in general. We must remember always that 3% of, almost all of Canada lives within 100 miles of the American border, and only about 3% of the rest of the Canadian population lives in the other areas, and that's a very significant spread out number of people. If you happen to be somebody who's living in, for example, Inuvik, and you're struggling with an addiction issue, then it's very costly to provide services, and as a result, those services are going to not have the same dexterity as they might have in a place like Vancouver, where there's a critical mass of people being supported, and therefore you can have a whole range of professionals, each bringing something new to the table. So many people find that the mental health services that they want are not able to really address their unique needs or complex needs, and sometimes they have to endure lengthy waits or bureaucratic processes that can be difficult for them to navigate, particularly if their mental illness affects their cognitive awareness, their skill set in terms of thinking through things or planning. It can be particularly difficult to get through bureaucracy. Or if it affects them affectively, they may become more easily frustrated or emotional and find it's very fruitless for them to go through the system. When we think about the lengthy waits, this is particularly important in thinking about the individual with a substance abuse disorder, because sometimes people are contemplative, they're ready to go into care, but the system isn't ready to access them. And in the period of time while they are waiting to get into that care, the person may give up or may return back to active drug use. Many people, because of their inadequacy in terms of housing or because of poverty, may be more vulnerable to crime and more vulnerable to drug use. In fact, those two things go hand in hand. As people become engaged in drug use, they have to engage with people who may be criminally involved as well. As we mentioned back in Module 1, decompensation, which is the symptom where an individual's symptoms flare up, or a better way of putting it, their normal coping methods stop working as effectively for them, occurs often when they're particularly stressed. Now, many people with mental health needs actually will have effective approaches, but they will start to wane just because. It could be because the person has gained or lost weight, because the person has changed something else in their lifestyle, or even just as a function of the individual's age or an evolving condition. For example, a condition such as dementia is not going to be stable. It's not going to stay the same, and the individual needs to consistently be monitored by their medical team. We also know that individuals with mental health diagnoses are more likely to encounter the legal system. It may be because of criminal involvement. It may be because they are having issues, for example, around tenancy. It may be because they're involved in violent behavior or are victims of violence. But they're often involved with the legal system and often ill-equipped to manage their way through that system, partly because of the poverty we spoke of earlier, and partly because, in terms of cognitive aptitude, they may have difficulty understanding these, again, complex and sometimes bureaucratic systems. The person may be very reliant on social systems, and because social systems can often be changed with the stroke of a pen, that means that individuals may have considerable instability in their life. For example, a few years ago when Alberta changed its welfare rates, we saw a sudden influx of people coming west who were homeless and found it difficult to access care here. And the province of British Columbia said, well, we don't want to suddenly have an additional population of people taking our social welfare systems, so they changed overnight the residency requirement for an individual, the amount of time somebody needed to live in BC before they could access this system. Well, there were some people who had legitimately moved here and were simply caught in the middle by this policy change. In some cases, for example, in the area near Mount Pleasant in Vancouver, social housing was demolished as a decision made by both the provincial and Vancouver civic governments, and that meant that suddenly people found that they were unstable in their housing. Even if they were able to find new housing, for many individuals, that period of transition, that uncertainty and disruption in their normal routine would cause for many people significant psychological stress and lead to decompensation. In many cases, people are on medications that help them tremendously, but there are side effects to medication, and some consumers prefer to go through the original symptoms as preferential to their mental health symptoms. They'd rather have, for example, tics than have a feeling of being sedated or less conscious and alert. So medication side effects can be very significant for many individuals, and that's just talking about the side effects that occur in the moment. Many side effects don't start to kind of erode until after about a month or more of usage, particularly for antidepressant or antipsychotic medications. And so the person has to really trust their clinician, because the therapeutic effect of the medicine may not take place for 3 to 4 weeks, and yet the side effects are most prevalent and obvious in those first 3 to 4 weeks. And so the person has to find a way of trusting that the side effects are going to diminish and the therapeutic effects are going to climb. And we spoke earlier about tardive akathisia and dyskinesia, and those are side effects that not only occur with medication, but they occur in a hidden and later on way. They occur years and sometimes just 6 months or a year after a person has been using that particular prescription. And they often don't start to show their full effects until the individual actually titrates off or reduces that particular medication. And that's one of the things that can be very difficult. Now, there are medications that people can take to help with the side effects, such as benzotropine, but they're not really a substitute for never taking the medication in the first place. So many people will struggle to find a particular medication or combinations of medications that will work well for them. And particular if they are people who have a lot of instability in their life, who have a condition that is rapidly worsening, or who, for example, don't regularly eat or sleep. They haven't got the same type of nutrition in their body, and that will affect what's going on with their medications. Can you think of others? What other sorts of things do you imagine would be impacts as a result of a mental health diagnosis? And how would these things affect the recovery of the individual? Go ahead and write that in your journal.